Okay, so I've stitched all the way to the end. Okay, up to this point, there's 2 strands, right, of the whip stitch sutures. So we can stretch the graph now. Okay, and then we take 1 strand of the whip stitch suture, pass through the graph. Okay, because Prof wants to put the whip stitch end in the middle of the graph. Bring the sutures together, stretch it out. Okay, make sure the graph is in the middle, bury it in, and then hook into the rubber band. Okay, next one. So if you were to measure, this is 60. Graftlink has to be 60. Okay, once this is done, we will start to do the tuberization. Tuberizing, Prof will do two tuberization on the tibial side where the whip stitch area is, and 1 tuberization on the femur side. This end of the femur is about 20, so approximately here. Okay, so you start from the center, middle part of the graph, and out. It doesn't matter if it's out towards you or away from you, it doesn't matter. Okay, then leave a short tail. Then pass through back to the other side. Make sure you catch all 4 strands. Usually Prof will go about 3 times to catch. 1, 2, 3. More importantly, just make sure we catch all strands. Okay. Okay. Make sure it's taut and tight. Okay. Once after that, we will loop around. We'll go around. Okay. When you are going around, make sure you are holding on to it so that it will not come loose. About 3 rounds is enough. Okay. Once that is done, then you pierce through to the mid part where the short strand is. Okay. Yep. Once done, then we tie. Tie knot. 1, 2, 3. Okay, then we cut the short strand. Be careful not to cut the knot. And we bury the knot. Pull tight. Yep, it will hear a tuck sound. Then we cut flush. First one done. Total you have to do is 3. So I will show you one more round. So at tibial side, it's 10 and 20. So I'll do the 10. Okay, approximately here. Same thing from the middle out. Leave a short tail. Okay, and catch all 4 strands. Second, and catch all 4 strands. Okay, once that's done, we'll go around about 3 rounds. 1, 2. Make sure you are holding on to the sutures so that it will not be loose. 3. And then we pierce to the mid part where the short strand is. pull tight, and we'll tie a knot. Then we'll cut the short strand. Careful not to cut the knot. And we'll bury the knot. Pull tight. You will hear a tuck sound or tuck feel. And cut flush. Removing the graft, press to disengage and bring closer. Remove the fiber loop first. Okay, then hold it this way for the tie rope ABS. Bring closer if you need to, and then just pull back. This is to prevent any shortening. The femur side, just pull the head back and use the button to bring out. There you go. Make sure the loop junction is seated inside the graft nicely.